Hello and welcome to Healing Touch Review of Techniques Level 1. My name is Ann Day and I'm a certified holistic nurse. I have a master's degree in health and wellness and I'm an internationally certified Healing Touch practitioner and instructor. My Healing Touch journey began in 1985 when I met Janet Menken, who was the founder of Healing Touch, and she was teaching classes at a community college in Denver, Colorado. I started taking classes from Janet. She was teaching classes in healing, and I immediately realized that this is where I needed to go. This was part of my path. It really connected me to why I'd been drawn to nursing in the first place. It was wonderful to watch Janet as she expanded her classes. There was a huge response, and in the late 80s, the American Holistic Nurses Association asked if she would collaborate with them to make a program, a certificate program in Healing Touch. This program was launched in 1989, and soon thereafter it began to spread through the nation with various classes around the country, and then very quickly spread internationally also. The first certification in Healing Touch was in 1993. And I was blessed to be part of that first group certified as a practitioner and instructor. And I've continued to be certified for 20 years. I love this work. I'm very committed to it. And I teach both nationally and internationally through Healing Touch International, which is a nonprofit located in Denver, Colorado. I'm so passionate about this work because I've seen how empowering it is for people to learn how to take care of themselves, how to use these techniques to help themselves heal, as well as very significantly helping other people. Besides being very self-empowering and learning how to help others, it really opens people's perception in how to perceive their world energetically, which then leads to life changes. Therefore, I'm completely committed to continue to practice this work as well as teach others. Healing Touch continues to be endorsed by the American Holistic Nurses Association. And if you take classes, you can get continuing education credits through the American Holistic Nurses Association, as well as the California Board of Nursing, and as well as the Certification Board for Body Workers and Massage Therapists. However, you don't have to be a nurse or a massage therapist or a healthcare professional to take Healing Touch classes. Anyone can learn Healing Touch as long as you have a desire to help yourself and to help others. I am dedicating these videos to Janet Menken as founder of Healing Touch as well as founder of Healing Touch International. Janet was a very compassionate, intuitive nurse, and she built this program based on nursing ethics, nursing standards, and nursing knowledge. This has given this Healing Touch program great credibility in the healthcare setting. Janet's vision was that someday there would be a Healing Touch student or practitioner in every home, able to help all families with self-care. We continue to uphold her vision by teaching people Healing Touch all over the world. Healing Touch works in collaboration with standard medical, nursing, and wellness care. It is not to take the place of medical care. Many hospitals are beginning to bring in integrative health care into their hospital settings and are offering Healing Touch as part of their patient care with great results. There are 5 class levels in Healing Touch. And for those who choose to move through all 5 levels, you can become a Healing Touch practitioner. The purpose of these videos is to provide visual aids for those who have taken Healing Touch so that they can practice and become more proficient in these techniques as they deepen their awareness of energy medicine. All of these techniques are carefully described in the workbooks that are given out at the different classes. Another great reference that I like to recommend are these quick look reference guides that you can get through Healing Touch International that you can buy on the website. They describe and show pictures of each of the techniques, and so they're very helpful for students to review. I also hope that those who are not familiar with Healing Touch and look at these videos will begin to spark an interest to take a class. These videos are not meant to replace taking classes. These classes are very experiential, and it combines didactic material with then giving and receiving much energy work. So when you come to a class, you receive many energy treatments as well as learning how to give them to others. The other thing that you learn in these classes is how to perceive energy in a new way. And so this is what creates life-changing experiences. One of my favorite quotes that really speaks to this is from Dr. Wayne Dyer. And he says, when you change the way you look at things, the things you look at change, which truly is what you find out when you become more energy sensitive within your world. I'm demonstrating these techniques as I learned them from Janet Menken, and as I've taught them to thousands of students over the last 20 years, and as I've practiced them in my private practice. However, they might look slightly different from the way another instructor might have taught you. Please know that any subtle differences are not right or wrong. The important thing is the intentionality of the energy. These techniques are based on very careful objectives set up at the beginning of this program. So really the classes will look the same and the techniques will look the same around the world. I was just teaching in Japan last year, and as I watched the students, it was wonderful to see that all of those techniques looked exactly the way we had taught them here in the United States. The definition of Healing Touch is that it's a biofield therapy, an energy-based approach to health and healing. It uses gentle, compassionate, heart-centered, nurturing energy to clear and balance and energize the physical, emotional, mental, and spiritual fields. We teach students to influence the energy fields within and surrounding the body through the intention of their hands. One does not have to sense energy to be able to use this work. Actually, Healing Touch came from the ancient laying on of hands because it's using universal energy that's available to all of us. Therefore, it cannot really be owned because it is something that everyone can experience if they desire to learn how to help others with healing. The goal of Healing Touch is to restore and balance the energy field. With your intention, you learn how to boost this energy field so that the person's natural healing will begin to work better. I like to think of the image of a jumper cable. The Healing Touch practitioner or student who's doing this is like a jumper cable. You're connecting to universal energy and bringing that through you to boost the battery, the energy battery of someone who is depleted due to illness or stress. It's wonderful because the person who is acting as the jumper cable does not deplete their own energy because they are connecting with an unlimited supply of universal energy and bringing that through to boost the battery of the person needing a little boost for their self-healing mechanisms. One of the important foundational principles that we teach at level 1 is that energy follows intention. Therefore, we can direct energy through our thoughts. This is a very important thing to practice, sending your intention through your thoughts. The other very important part of doing this work is to be centered in the heart with compassion and unconditional positive regard for the other person. Research has shown that there are many benefits to Healing Touch. It's very good at reducing stress, anxiety, and depression. Another important benefit is reducing pain and the need for pain medication. It also boosts the immune system, so the natural healing within a person can work better. It's very good for enhancing recovery from surgery and any other invasive medical procedures. It's very good for supporting cancer care and any other chronic illnesses. They found it creates a wonderful sense of well-being and balance. And it also helps enhance spiritual connection. Healing touch is used now in many hospitals, hospices, nursing homes, and private clinics, but it is also used in people's homes to help themselves and their family members. I just want to review quickly about the chakras and the energy fields. Remember that chakra means a spinning wheel of light, and these chakras are transformers and transmitters that are very important for the energy of the body. There are 7 major chakras. The first chakra is the root chakra. It's right at the base of the spine, and it has to do, the function of the root chakra is physical strength, vitality, will to live, and groundedness. The vibration of the root chakra is red. The second chakra is the sacral chakra, and it is in the lower abdomen. The function of the sacral chakra is emotions, relationships, sexuality. And the vibration of the sacral chakra is the color orange. Moving up to the solar chakra, it's right at the solar plexus where your ribs come together. The function of the solar chakra is the self-esteem, the ego, and the will. The picture of who you are out into the world. The vibration of the solar chakra is yellow. Then we move up to the heart chakra, the 4th chakra. It's right at the base of the sternum. The function of the heart chakra is compassion, healing presence, unconditional love, and innate harmony. And the vibration of the heart chakra is green. Moving up to the throat chakra. This is an important chakra that has to do with our expression of our truth, and putting our voice out into the world. The vibration of the throat chakra is blue. We move up then to the brow chakra, right in the center of the forehead. This is a center for intuition, for sensing energy, and for guidance. And the vibration of the brow chakra is deep blue and indigo color. Then the crown chakra at the top of the head is your spiritual connection. It starts with violet, it moves up to white. This is an important connection for us on the spiritual level. Just to review quickly, there are 4 energy fields that we speak about in level 1. And these energy fields change depending on our thoughts and our emotions. The first layer of the field is the etheric layer. It is the layer that's closest to the physical body. It extends out only a couple inches. It's very structured with fine blue lines, and it's the one that's most easy for people to begin to feel as they start to sense energy. The second layer of the field is the emotional layer. This layer extends out further in the field, and it's very movable. So depending on the emotions, it can be either close to the body or it can go out quite a ways. It's multicolored, rainbow colored, and very fluid and movable. The third layer of the field is the mental layer. And again, this one is structured with fine yellow lines, and it holds our thought patterns. The fourth layer of the field is the intuitive or spiritual layer of the field. This again is very fluid. It goes out further. It can go out several feet from the body, and it is connecting more to spirituality and the energy of the universe. All of these fields interpenetrate. They begin deep in the body and they interpenetrate out through the field. And we teach students in level 1 class how to learn to assess these fields and these chakras with their hands, their senses, and we also teach how to use a pendulum that helps to read the chakras, whether they're open or compromised. I like to call the pendulum my energy stethoscope. The goal of Healing Touch is to balance all of the chakras, to open the energy fields so that they're flowing, and the energy is flowing and the chakras are bringing the energy into every part of the body perfectly. So as we begin going into the techniques, I'd like to lead you in a short centering and grounding meditation. We teach in level 1 that this is one of the most important things to do, is to prepare yourself by being totally centered and grounded before you begin any kind of healing work. Centering means very present in the moment and feeling at peace, and grounded means very connected to the earth. So I'm going to lead you in a short meditation to help you practice this. And you can do this either in a chair or you can be standing. And I will invite you to gently close your eyes if you're comfortable. If you're not comfortable with that, you can leave your eyes open. So as we begin the centering and grounding meditation, I just invite you to take a nice, slow, deep breath and gently close your eyes. Listen to your breath. Slowly in, hold for a second, and then slowly out. The breath is a very powerful tool for bringing you to the present moment. And as you breathe in, I want you to feel yourself breathing in peace and serenity and being present with this moment. And as you breathe out, I'd like you to let go of any distractions that might be in your head, things that you've had to do, or any concerns or stressful things. Just let them all go. Be totally present in this moment. So breathing in, going in deeper, being very present, breathing out, letting go of anything that distracts you from being in total peace at this moment. Feel yourself relaxing with this centering, being very present. And next, I would like to have you image yourself as a beautiful tree. Put yourself in a beautiful forest or wherever is comfortable for you, and see yourself as a large, beautiful tree with a very strong trunk. But through your feet, there are roots. The roots of the tree are going down deeply into the earth. This is very important so that you stay connected with the earth during your work. So feel those roots deep within the earth, and then imagine coming back up through the trunk of the tree, going up into the branches, and imagining that even if there's some breezes or winds blowing, that you are so well grounded in the earth that nothing disturbs you as a tree. So now you should feel very centered, very present, and very grounded. And it's at this point that we always ask you as a healer to set an intention for the highest and best for the person that you will be working with. I'm going to be using the term client as I move through the techniques. We work on patients in hospitals, and we often see people outside of the hospital that we call clients. Interchangeable word, but just so you know, I'm going to be using the word client. So now that we've prepared ourselves with being centered and grounded, I'm going to have you practice a little hand exercise that we do in level 1 that helps you begin to warm up the energy molecules in your hands. So just take your hands, rub them together briskly, begin to feel that friction, and then let your hands come apart about 12, 14, 16 inches, whatever feels comfortable. Begin to move your hands in slowly, and you will begin to sense a little vibration. Sometimes it's a little pressure. Sometimes it feels like a magnetic resistance. and then let your hands go a little bit further apart, and then coming back together again. This is kind of a way to warm up your hands to get them ready for the healing. Once you get more experienced and you've really practiced a lot of healing touch, you won't have to do this. But just at the beginning, because so many people say, I'm not sure I'm feeling the energy, it's good to just practice this hand exercise to get the energy going. So just pay attention a little bit. Sometimes it helps to close your eyes so you can really focus on what you're feeling between your hands. So our first technique is the basic healing touch sequence. This can be done both in a chair or with the person on the table. And I'm going to demonstrate it on Molly today in the chair so you can see how that is done. This is a wonderful technique that promotes relaxation. It reduces stress and tension. It can restore a feeling of balance and wellness for the person. So it has many wonderful benefits. So I'd like to begin with the first step of the basic healing touch sequence. The first step is to do an intake with the person you're going to be working with. So I'm just going to ask Molly if she has any special areas of need today. And as you talk to the client, you're going to energetically begin to connect with them because you want to connect heartfully with whoever you're working with. So Molly, do you have any special areas today that you'd like some healing with?
Well, I do carry a lot of tension in my shoulders.
Okay.
I have some minor foot pain.
Okay.
Other than that, that's about it.
Okay, and which foot?
Your left.
Okay, that's good to know. Okay, so I've done a little intake. Oh, one other thing that's important always to ask, is it all right if I touch you?
Yes.
There are some people that don't like to be touched, and healing touch can be done with your hands completely off the body. But if it's possible, we do like to rest our hands on the body occasionally. The second step of the basic healing touch sequence is called healer preparation. We just did this, but I just want to review for you the importance of, again, centering, grounding, and setting the intention for the highest and best for the person that you'll be working with. So the third step of the basic healing touch sequence is called the pre-treatment energy assessment. And this is the time where you use your hands as antennas to begin to feel the energy field from the head all the way down to the feet. So I'm checking through the field to see what I feel. I can feel the edges, the subtle energy of Molly's field about here and here. And then coming in closer, you look for any prickles or any cold spots or any hot spots, or sometimes if there's congestion, it feels kind of like a thickening of the energy. I'm going down and feeling her legs, her knees, and all the way down, especially to her foot. I feel a little cold spot over that one foot that she's talking about, having a little pain. So you just notice what you're feeling, and that is considered your pre-treatment energy assessment. So the fourth step of the basic healing touch sequence is when we begin to go into the healing touch interventions. And as I begin this, I like to just attune to the person in the chair by putting my hands lightly on their shoulders and beginning to feel an energy exchange with that person. So the energy from my hands are going into Molly's shoulders and we're beginning to make a connection. Then we begin to use magnetic passes, and magnetic passes is using the energy of our hands to pass through the field. This is called magnetic passes, hands in motion. And the hands are in motion with this, generally smoothing down from the top, down slowly and smoothly. It begins to smooth all the subtle energy lines in this field, smoothing and balancing and energizing as we do this. If Molly had some pain, I would work, if she had pain in her shoulder, I would do a little bit of hands in motion at that point to help reduce the pain. I'm smoothing the energy field down the front, down the legs, and all the way down to the feet. All the way down to the feet. In fact, I'm going to do a little hands in motion over that toe that she said had some pain, as though I'm just smoothing that pain away with my hand. Smoothing down the legs again. Just lean forward a little bit, Molly, and I'm going to smooth over your back. It really feels good to have hands in motion over the shoulders and the back, because it begins to just sweep away any of the tension, the shoulders and the back. Smoothing, it's like you're brushing a beautiful fluffy bird's feathers. I like to think of that, smoothing the feathers and making them nice and smooth so that it creates balance and harmony in the energy system. Now you can lean back. So then the next part of the interventions is called magnetic passes, hands still. You put your hands wherever you're led to put them on the body, or where the client has told you they might have some need for healing. Because Molly mentioned the stress in her shoulders, I've decided to let my hands go relaxed position, hands still on her shoulders. With your breath, just allow the energy from your hands to move out through your hands into the client's shoulders or wherever you're holding. The beautiful part about energy work is that energy has a wisdom of its own, and it goes where it's needed in the body. So even though I'm holding the shoulders, if there was a need in Molly's low back for more energy, the energy would flow there. That's a beautiful part of this work. You don't have to figure it all out ahead of time. So hands still, you hold your hands, letting the energy flow from your hands into the person that you're giving the treatment to, and you wait till you feel a sense of completion. Sometimes this is 2 minutes, sometimes it might be 5 minutes or more, depending on the need. So you begin to feel the sensitivity of when it's complete as you practice this more. One of the signals that it might be complete is a sense of fullness under your hands that might even make you feel like you want to lift your hands up a little bit. So whenever it feels like it's complete, then you gently lift your hands up. And I like to finish again the interventions with a little bit of hands in motion again. Hands in motion so that you sweep away any remaining congestion. So smoothing one more time all the way down the field. Oh, it feels so good, it's so relaxing. Smoothing over the field. Gently, gently smoothing. Top to bottom. So the fifth step of the basic healing touch sequence is called post-treatment energy assessment. We go back to using our hands as antennas again to assess how the field feels differently than it did at the beginning. Has it changed? Has there been any difference? Has the magnetic passes, hands in motion and hands still, made a difference in that energy field? So I'm feeling, sensing that Molly's energy actually is a little bit more extended than it was at the beginning. It's a little warmer. As I go down her feet, that little toe that was hurting feels warmer, not as cold. Her energy field feels very nice and smooth. Her field is more expanded. It feels very energized, and it feels balanced. So this is the post-treatment energy assessment. So the sixth step of the basic healing touch sequence is called ground and release. We help the client ground. That means really reattach to the earth. Sometimes they get very relaxed and you want them to be fully in their body, and then you release from their energy field. So the best way to do this really is to come down to their legs. Rub the legs down a bit and hold the feet. So Molly, I just want you to imagine that your feet are really connected to the earth. Feel your feet on the earth and feel yourself totally present in your body. And then I will consciously release myself from the connection with her energy field. Then the last step of the basic healing touch sequence, and I'll just stay right here so I can talk to Molly, is called the evaluation and feedback. So Molly, how are you feeling?
I'm feeling great.
Okay, great. And how is that foot feeling?
It's feeling better, I'd say.
Okay, good. And what about the shoulders?
Less tension. I feel very relaxed.
Okay, well, thank you very much. The next technique I'd like to demonstrate for you is called magnetic clearing. And this is very good for sweeping the field free of any congestion or any toxins in the field. As we have instructed on all of the techniques, it's best to first start with some centering. Make sure you're centered, grounded, and set the intention for the highest good for the person on the table. Then I'm going to begin by just doing an energy assessment to see where I feel congestion. Usually I like to work from the head down, but you can work from the feet up just to feel and assess that field before your hands start actually doing the intervention. Now this is really excellent, an excellent technique for using after someone has had surgery to help sweep away the side effects of anesthetic. The way you do magnetic clearing is you start above the head approximately 12 inches with your thumbs together, and your fingers are going to be softly curved like rakes, and you slowly comb through the field with your energy fingers extending out like light rays from your fingers, raking away any congestion in the field. I move slowly so that I can really collect the congestion, bringing it down, all the way down, and off the feet. You don't want to move too quickly, because if you move too fast, you really don't hook into the energy with the magnetic fingers. So moving slowly, I'm moving down the midline, keeping my thumbs pretty much down the midline of the body, my fingers curved, and again feeling the magnetic attraction to my fingers of any congestion. As I said before, this is an excellent technique to use on someone after they've had surgery and been under anesthetic. I myself remember after surgeries to wake up and feel the Healing Touch practitioner doing magnetic clearing over my whole body was so wonderful, because it felt like it was actually helping me emerge from a thick cloud. Moving slowly, again, down the body, about 30 seconds for the whole body sweep. If your fingers start to feel like they're getting a little heavy from the congestion, just take a moment and brush them off. And then go back to the head. We usually recommend that you do this about 30 times, which means about 15 minutes, ideally, to totally clear the energy field, because each time that your hands move down through the field, they're actually clearing a slightly different layer of the field. The fine little subtle lines of energy get so congested after things like anesthetic that it takes many times to clear that congestion away. The other way that this can be used is if someone has had a toxicity from environmental pollutants. You can clear again the side effects of those toxins with this magnetic clearing technique. It's also very useful for clearing away the side effects of any kind of drugs, nicotine, alcohol, or effects of addictions like smoking. It begins to clear the field from those residual effects that can be in the energy of field. Another indication for using magnetic clearing is after someone has had chemotherapy or radiation therapy. This does not clear away the chemo that is useful for the body for killing cancer cells. What it does is it clears away any side effects that might cause nausea or headaches or any feelings of fatigue that come with the chemotherapy. Also good following radiation for the same reasons. So once I've done about 10 sweeps down the middle of the body, I move to one side of the body so I can completely clear this whole energy field. And again, I move slowly. My hands are still like magnetic rakes moving through the field and all the way down through the body at about the same speed. It's wonderful if you have another person who can help you with this, who can be on the other side. Then you can work together. And if you're working 2 on 1, you really want to keep your hands together, moving at the same speed through the energy field so that you would keep your fingers connected or close to touching so that you are raking the same parts of the body at the same time. The 5th indication that I want to mention as I'm doing this is emotional congestion. I have found, and I'm going to start doing the other side while I'm talking about this, I have found this is very helpful for people who are suffering from grief or loss. It helps to release the congestion of that emotional trauma that they've had, and it is very effective. So I have used this with people who are grieving, and I had one person tell me after I did magnetic clearing, after she was complaining about feeling very fatigued after her mother died, once I finished the magnetic clearing, she looked at me and said, "I feel like you've removed a bag from my head." She said, "I'm so much clearer and I feel more energetic than I have in many days." So to me, again, it was a very good demonstration of how magnetic clearing can help to clear away emotional congestion as well as congestion from chemotherapy, from drugs, from anesthetic. And so again, I would probably do 10 of these sweeps down the center of the body, 10 down one side, 10 down the other side. The goal is to continue this until the field feels very smooth. So that is the magnetic clearing. The next technique I want to demonstrate is the Chakra Connection. This is one of our favorite techniques. It's a full body technique. It helps to balance and restore the body all the way from the feet up to the head. It balances and connects the chakras, and it will energize the body as well as provide deep relaxation. So it's very wonderful to use before a surgery or before a medical intervention to get the person very relaxed. It's also excellent for using after surgery to again promote relaxation and speed up healing. This can be done one-on-one the way I am going to demonstrate it first. It can also be done with 2 practitioners working on one person, or it can be done on yourself, and I will demonstrate that later. But it is a wonderful technique. Again, I always like to start first, after I center myself, of course, with an assessment of the field. When you do this assessment, you don't leave your hands in one spot too long because you're just checking for any differences in the field, for any coldness, any heat, any fluctuations in the energy field that might indicate some pain or imbalance. So this technique, the Chakra Connection, was taught to us by Dr. Root Joy, and he has given us permission to teach it. It's a wonderful technique, again, full body, and you start with the ankle and the knee, and you put your hands lightly on these places. Again, if for some reason someone did not want to be touched, this can be all done with your hands in the energy field, not touching. But since Molly said I could touch her, I prefer to lay my hands lightly on her leg, the ankle and the knee. As you start the Chakra Connection, you want to visualize again the energy from your hands, from your palms, going into this part of the leg. And I like to just really settle in and feel the subtle energy, because it begins to flow back and forth between my hands. So I'll feel it going from one hand up to the other, and then softly back until it balances and connects. So back and forth, and again, energy can be visualized as light coming from your hands. Back and forth, connecting and balancing between the ankle and the knee. Then you move up to the knee and the hip. Again, beginning to feel the energy flowing from my hand on the knee up to the hand with the hip, and back and forth. It almost feels back and forth slowly until it balances, and then it becomes very uniform. Usually it's about a minute that you will want to hold each position. So I'm balancing from the knee to the hip and back, and now it's beginning to feel very smooth and balanced. So once you get to the hip on the first leg, you put your hands over to the other leg and begin again with the ankle and the knee, beginning to send the energy through your hands smoothly back and forth between the lower hand, the upper hand, back and forth until it really balances and connects. Be sure that you're well grounded as you do this. Make sure your feet are apart so that you have a good foundation. And once you feel that fullness and balance, then you move up to the hip on the second side. The knee and the hip on the other side of the body. Again, energy flowing through my hands, back and forth until it feels balanced and feels full. The more you practice this, the more you're going to feel the energy, and you will be able to appreciate when it becomes balanced. As I said before, this is really a wonderful technique for anyone who needs deep relaxation, but particularly before surgery or any kind of invasive techniques medically, because it gets the body very relaxed and ready to open and receive in the best possible way. Once you have come to the top of the second leg with the hip, then you put your hands across so that you're going hip to hip, sending energy from one hip to the other hip, back and forth. Deeply relaxation helps to restore a feeling of well-being. So once you've balanced across the hips, then you begin to move to the major chakras. You put your lower hand over the root, your upper hand over the sacral. It's always important when you're energizing the root chakra that you are a ways away from the root. And it's helpful to lay your wrist on the top of their leg so they know where your hand is. Because energetically, it can feel as though the hand is actually on the root, which is right at the perineum, which would be uncomfortable, of course, to anyone. So you hold your hand here, let the person know where your hand is by a little pressure on their thigh with your wrist. But you're directing energy up to the root and then to the sacral. So back and forth, connecting the root and the sacral chakra. Once you feel that it is balanced and connected between the root and the sacral, then you smoothly move your hands to the sacral and the solar chakra. Remember, the sacral chakra is in the lower abdomen, a couple inches below the navel. The solar chakra is right at the solar plexus, right where the rib cage comes together. So, sacral and solar balancing back and forth. Usually producing deep relaxation as the body becomes balanced, especially over the major chakras. And then I'm going to move my lower hand over the spleen. This is a point that Dr. Brujoy felt was a very important energy point. So he added it in to the Chakra Connection right at this point so that you do the solar chakra and the spleen together, balancing back and forth. Again, the energy from my hands smoothly moving in and connecting back and forth until it feels very smooth and balanced. If you're not sure, you can wait about a minute for each hold. Once it feels balanced there, then the hand that's on the spleen moves to the solar and the upper hand to the heart chakra, which is right at the base of the sternum in the middle of the chest. I'm putting my hand just lightly here and sending energy into the heart chakra and back and forth between the solar chakra and the heart chakra. It's really important to keep looking at your client and making sure that they're okay, that they're feeling relaxed, and you're connecting the solar and the heart. The next point taught by Brujoy is the heart and the high heart. And the high heart is right between the throat and the heart chakra. It's really right over the upper sternum. And this is an important point to balance from the heart to the high heart. Back and forth until you feel the balance. And again, I'm going to move just a little more quickly for demonstration purposes. But once you get to the high heart, this is your cue to go to the arms. So you move to the wrist and the elbow on the arm closest to you. Again, just as before, you begin to send the energy through your hands. Beautiful light energy moving back and forth between the wrist and the elbow. So then, when you feel it's balanced in the lower arm, move to the elbow and the shoulder. Each time you move, see the energy from your palms sinking in and beginning to send energy between your hands, balancing again between the elbow and the shoulder, connecting those minor chakras, elbow and shoulder, back and forth. And then it begins to become very balanced. It feels very full and very smooth. And once you feel that, then you can move to the other arm. I'm going to reach over to the wrist and the elbow on the other side. And certainly if you're working with someone who is in a hospital bed and you can't reach over, or if the person is quite large and you can't reach over them, just go around to the other side of the table or the bed. Again, I'm balancing between the wrist and the elbow, sending the light energy through my hands back and forth until it feels very connected and smooth and balanced. Then I will move up to the elbow and the shoulder on this arm. Again, feeling the energy back and forth, smoothing, balancing, connecting. And once you get the balance to the top of that other shoulder, you move across the shoulders just as you did with the hips. Back and forth, one shoulder to the other, totally relaxing her, balancing between the shoulders, connecting the shoulders of both arms, so that both arms now are connected, balanced, and across the shoulders. The next step, you move back to where you left off, the high heart and the throat. We never want to touch the throat because the throat chakra feels very vulnerable to most people. And if you were laying your hand on the throat, it might make them feel a little bit like choking. So just keep your hand above the throat chakra. My lower hand is at the high heart where it left off before I went to the arms, connecting the high heart and the throat. The next step is to go throat to the brow chakra. As you can see, we're balancing and connecting all the chakras. We're going now from the throat to the brow, sending the energy back and forth, balancing and connecting throat to brow. The next position is brow and crown. So your hands are on the brow and at the top of the head. Back and forth, balancing the brow chakra to the crown chakra. This is actually up to the 7th chakra, but we're going to do one more position. We take the lower hand that's on the brow and we put it on the crown, and you turn your hand out to catch some energy called a transpersonal point. That's universal energy. So you connect with that point. That's about 12 to 14 inches above the head, the transpersonal point. And this then completes the chakra connection. I always, however, want to do a little bit of magnetic passes, hands in motion, over the whole body, from the head all the way down to the feet after I've done a chakra connection. Just again, smoothing the energy field. It always feels really wonderful to have the energy field smoothed. She's now balanced and all the chakras are connected. And remember, you can do this with a partner. You can do this one-on-one or on yourself, which I'll show you in a little bit. So now I'd like to show you the self chakra connection. This is very useful for balancing yourself, and it's a very nice thing to do at the beginning of your day. We start with the bottom of the foot and the ankle, and just as you learned with the chakra connection, you send the energy from one hand to the other hand, back and forth through the bottom of the foot to the ankle. You want to hold each position approximately a minute. I might move just a little faster for demonstration purposes, but do this where you can take the time for a minute for each position. After the bottom of the foot and the ankle, you move to the ankle and the knee. Again, back and forth, balancing the energy between your ankle and your knee. Feels very nice, very relaxing. And then the next position, you move to the knee and the hip, letting the energy flow from the knee up to the hip, back and forth, until you've balanced and connected the knee and the hip. And this is completing the balancing on this first leg. So once you feel that first leg is completely balanced and connected, then you move to the other leg. Again, you start with the bottom of the foot and the ankle, sending the energy back and forth, bottom of the foot, ankle, balancing, connecting. Then moving to the ankle and the knee on the second leg, back and forth, balancing, connecting. Then to the knee and the hip, all the way between the knee and the hip, which balances and connects now the second leg all the way up. So once you feel that you're completely balanced now on the second leg, you move your hands to the hips, one hip to the other hip, sending the energy back and forth, left hip to right hip and back to left hip. And you will actually feel a flow of energy connecting the hips. Again, very relaxing and balancing. And once you have the hips connected, then you move to the major chakras. The root between your legs and the sacral, which is in your lower abdomen. So you're connecting the root chakra and the sacral chakra. Holding, connecting, feeling that flow balancing between the hands. Opening up and balancing this lower part of your pelvis. Then you move to the solar and the sacral, sending the energy back and forth, balancing and connecting those chakras, which really is a nice balancing for the upper part of the abdomen. The next position, we bring in the spleen, as we did with the full connection, and back and forth between the solar plexus and the spleen. Back and forth, connecting solar plexus to spleen. The next position, you move the lower hand to the solar and the upper hand to the heart chakra. So now you're connecting the solar chakra to the heart chakra, back and forth. This is a very good time to remind yourself to embrace yourself with unconditional love and compassion, the energy of the heart. Back and forth, solar to heart. It's like a meditation doing this first thing in the morning. Then move so that the lower hand is on the heart, the upper hand is in the high heart, between the throat and the heart. Heart and high heart. Breathing that in, feeling the balance, feeling the connecting. Remember how I said that when you're at the high heart, it's the cue to go to your arms. So we will do that. We can hold our wrists and balance wrist to wrist. You balance your wrists, sending energy back and forth. Then your elbows, I'm doing it a little more quickly. You can hold each of these positions a full minute, balancing elbow to elbow. Then up to the shoulders, which feels very good because it's like a self-hug. It's like a nurturing hold back and forth between the shoulders. So at this point, the arms will be connected and balanced. And you'll be connected and balanced up to the high heart. Then you move to the high heart in the throat. As you put your hand over the throat, again, I usually have my hand just a little bit above the throat chakra. Opening the throat, remembering the throat is a center of expression, and just affirming that you can express yourself clearly. Back and forth with this energy. Then moving from the throat to the brow, up to the brow, back to the throat, connecting the throat to the brow. And then brow to crown. So once you feel it's balanced between the brow and the crown, then you take your top hand and move it up to the very top above your head, and you're connecting crown to the transpersonal point, which is a spiritual ball of energy above your head, about a foot above your head. You're connecting with that spiritual connection, crown to transpersonal point. Now, I like to end the self chakra connection by then reaching my hands up and imagining that I'm creating a bubble of light as I bring my hands down through my field. This is not part that you will see pictured on the self chakra connection, but it's just a very nice way to end, to feel like you have your whole energy field all intact with a bubble of light all the way down to your feet. And then you can relax, sit back, and just take a moment to appreciate feeling very balanced and connected for your day. So now I want to talk to you about pain management techniques and demonstrate 3 of the 5 we teach in level 1. I want to talk first about ultrasound. Ultrasound was something that Janet Menken taught us that focuses the energy from your palm through your fingers down into a stream. And the reason I'm holding my hand like this is because if you're practicing it with me, you can begin to feel the energy moving in your other palm. It's a more concentrated energy than when we have our palms open. And you can do it in circles, you can go back and forth, you can go in a figure 8. This technique is very well used for first aid. It's used for wound sealing. It's helpful for joints, going into joints, because it's a specific stream of energy and it goes deeply in the joint. So if I am ultrasounding over Molly's shoulder, if she had pain or a rotator cuff, I begin to move the stream of energy, again coming through my thumb and first 2 fingers, like a stream of energy. It feels a little bit more intense than when you're having your hand with the palm open. So it's a specific technique. That's why it's good for first aid. It's good for specific areas like joints, like wounds. If she had had a wound in her shoulder, I actually could move this ultrasound back and forth, imagining that I was weaving together the little tissues of the wound in her shoulder. It's also really wonderful to use with eyes, with ear situations, and with dental. So if Molly had just had some sort of dental surgery, I would use the ultrasound to begin to take away the pain. It's again a specific stream of energy, and so I'm moving it over the area. It's very good for relieving pain, and then I would smooth it away. Another place I really like using ultrasound is over the sinuses, because if someone has sinus congestion, this is a very good way to break up the congestion. If a person has sinus congestion, ultrasound is very good because it's specific and it helps break up the congestion in the sinuses. So you see that beam of light coming from your palm out through the thumb and 2 fingers and moving to break up the congestion, and then I smooth it away. It's very good to also do the other side of the sinuses, and you can use both hands, of course, back and forth, breaking up the congestion. And then I always like to just smooth it away, breaking up the congestion and then smoothing it away. I like to use a bit of a raking motion with my fingers and smooth until I feel that that is all brushed away. Another nice way to use ultrasound is specifically with joints like fingers. I actually have some arthritis in my fingers, and it feels really good to use the ultrasound on the joints in the fingers. So the next pain management technique is called laser. It's very specific, like the ultrasound, but it is more still. You hold with either 1 finger, 4 fingers, or 2 or 3 fingers a spot that you want to deeply penetrate. For instance, if you're wanting to help to seal an incision or seal something that is deeply into the body that needs some sealing, you use the laser. It goes in through the fingers, very specific, like ultrasound. But with laser, we use still hands or just slight movement. So it's not as much moving as the ultrasound is. Again, it's very good for sealing things, wound sealing. It can be good for relieving pain. It can be good for deep penetration in the joints. It's a wonderful pain management technique. The third pain management technique that I want to demonstrate is called pain drain. It can be used on any place in the body that's in pain. You put your left hand on the painful area, and I'm going to use Molly's right shoulder. You begin to pull the energy through your left hand, which is your energy receiving hand, and imagine that it's going up through you like a siphon and coming out through your right hand. So you begin to let the pain come up through, and I like to picture a golden Teflon hose so that it doesn't get stuck in my body, and pulling the pain out. I like to kind of coordinate it with the breath, so as I breathe in, I'm pulling the pain out of her shoulder and I'm letting it go through me and out my right hand. The right hand is the hand that sends the energy. So you continue to pull the energy, bringing it through you, draining the energy. And you can even begin to pump your hand a little bit if you feel a congestion building in your hand. Pumping the hand a little bit helps. You continue to hold this position until you feel like that pain is dissipating, or you can ask the person, how is it feeling, and find out if that pain is lessening. It's good for low backs, it's good for joints, any place where there's pain. And once you feel like the pain has dissipated, then you switch hands. You put your right hand on the shoulder, the left hand just raised a little bit so that you can refill that area with universal healing energy. Anytime we drain off energy, the principle is to refill it. So I'm putting my hand here to just bring in some energy from the universe. It comes through my left hand, goes up through my body and out through my right hand, and refills with healing energy to the place where the pain has dissipated. So that's the pain drain. Again, it can be used in any part of the body and is very effective for taking away pain. So now I want to demonstrate the mind clearing technique. This technique is very good for calming any mental chatter if people are having trouble relaxing and having a lot going on in their head. It's also good to relieve headaches. It's very relaxing, and it's good for any kind of brain trauma. So, because it helps to balance the brain, rebalance the brain, and there's very specific finger techniques here. You start with your fingers resting right on the top of the clavicle. Very gently, remember, because the throat is really sensitive. Your index fingers are just a bit up on the throat, and they are helping to balance the thyroid and parathyroid glands as you're doing this. So you make a connection with your fingers in to the base of the throat. And then you move to the second position, where you gently turn their head so that you can get your fingers behind the neck, and they're up in a line with the index finger right at C7, the base of the cervical spine, and all the way up to the occipital ridge. Your other fingers are going to be parallel, but they will be right at the brow. So your fingers are actually in the same line. You can't see it very well behind, but they're coming up the spine, and my fingers that are on her brow are lightly on the brow and sending energy back and forth between the back of her neck and through the brow. This actually begins to send a balancing energy through the pituitary and the pineal glands in the middle of the head. So once you hold that position till you feel like that energy is balancing and connecting, then you move your other hand under the occipital ridge. You hook your fingers under that occipital ridge so that you can put some traction on the neck. Usually this feels very good, but you always want to check and make sure there's no pain. Is there any pain with that, Molly, or does it feel all right?
Feels all right.
Okay. So when you're doing this hold, you're actually putting some traction on the neck, which helps to open spaces energetically in the neck. So it feels usually very good. And you hold it about as long as you can, using the table with your arms as traction on the head. Once you've completed that hold, you let your hands slide around the head so that the thumbs are at the top, right in the crown center, and the fingers are around the skull. So this hold puts energy through the whole brain. So your hands are energizing the whole brain, left and right sides. It's like a cap with your hands around the head, like a cap. After you've held that position and feel some balancing, you move your fingers on either side just above the front of the ear to a little point where you will feel a little bit of a pulse. It's not the temporal pulse, it's just a little bit of an indentation at the top of the ear. And you let your fingers slide into that, and you see that it balances. Visualize it balancing side to side. You don't want to put much pressure on. You just want to feel that pulsation. This is called the brain balance point. You're really balancing from the left to the right and back again, back and forth between the brain, right at that very significant point, just above the ears. I feel those pulses now coming into sync. So that's a very good time for me to move to the next position, where you put your fingers starting at the inner eyebrow up to the hairline. Your little fingers at the inner eyebrow, your index fingers up to the hairline. Gently again, not much pressure, very gentle touch. And after you hold this position for about a minute, you keep your index fingers connected, but you open your other fingers to the outer part of the eyebrow. This opens the brow chakra. It helps to open intuition. It helps to expand that brow chakra. So you hold that point again for about another minute. Usually during this time they become deeply relaxed, and it stops any mental chatter that they might be having going on in their head. The next position is you put your fingers, your index finger and your next finger, on the Tmj joint. The Tmj joint is the temporal mandibular joint. It is the most used joint in our body because it is our talking and our chewing joint. So it gets a lot of work, and often people hold stress in the Tmj joint. So lightly just move your fingers around on that Tmj joint, relaxing it and sending energy into that joint. Then you go with your thumbs over to the brow chakra and you sweep down the face to the chin 3 times. And then you hold a very compassionate, loving hold, putting your hands around their cheeks and supporting the chin. Feels really wonderful to have the mind clearing. And it certainly does balance the brain and help release any mental tension. So after you've held this position of the chin and the cheeks for about a minute, you end the mind clearing by putting your hands on the shoulders as an end to the mind clearing. A wonderful technique, very relaxing, very good for relieving tension headaches. And again, remember this one if you have someone who is having whiplash side effects that might be interfering with how their mental processes are working. So it's a very important technique to remember. So the last technique I'm going to demonstrate for level 1 healing touch is called the Chakra Spread. It's a very sacred technique. We do it at the end of the weekend, and we preface it with a wonderful meditation called the Heart-to-Heart meditation. Again, something we got from Dr. Root Joy that's very profound. We have 2 healers set facing each other with their hands over each other's hands, and they spend time, usually about 10 minutes, connecting their heart energy. This is a very beautiful meditation, and we do this before we do the Chakra Spread in the class. I won't be demonstrating that, but I will demonstrate the Chakra Spread. The Chakra Spread is a technique that we use for transitions. It's wonderful for people who are transitioning in the dying process. It's good for transitions, people going through major life changes. It's very relaxing, and it opens all the chakras and allows the body to balance in whatever way they need. And again, with someone dying, it helps them release from their body. It will not cause death. I want to make that very clear, but it can ease the transition. We begin by holding the bottom of the foot with the palm of your hand. So you hold the foot for about a minute to open up the soul chakra. We begin by opening both feet. Again, make sure your feet have a good foundation as you do this technique. Holding the foot, opening the soul chakra. Once you've held the first foot for about a minute, then move to the second foot. And again, have the palm of your hand over the sole of the foot, opening up that chakra at the bottom of the foot. This technique is one that you want to use at the end of any treatment session. We don't usually want to do any other techniques after the chakra spread because it's such a profoundly, deeply healing and relaxing technique. So remember, if you're going to use the chakra spread, use it last in your treatment session. After we've opened both soles of the feet, then you hold the hand, again, palm to palm, opening that chakra in the palm. Holding, opening. Then I will reach over and hold the palm of the other hand. Everyone who does this, say it's such a gift to be able to do the chakra spread. It's such a profound way to help people relax and release. Once you've opened both the palms, then you start over the crown chakra. You feel the energy of the crown and you begin to spread as far as your hands will go 3 times. Chakra spread. That's why it's called the chakra spread. Then we go to the brow, spreading the brow chakra 3 times. Now, as you do this, the person may be in a slightly different position. If that's the case, you can still do this, adapt it, but you want to go over each of the major chakras 3 times. So I'm going over the throat now. 3 times. Then I come to the heart, feeling the energy of the heart, spreading it out 3 times. The night my mother died, I was blessed to be able to spend that last night with her, and I did several chakra spreads to help her just relax and transition from her physical body to the spiritual realm. So that's the solar chakra. Sacral 3 times. Now the root. Then over the knees. Again 3 times. The number is 3 considered sacred geometry. I think that's maybe why this is used 3 times. Then over the ankles, Spreading the energy of the ankles 3 times. And then you move your hands as though you're removing an energy sock from each leg 3 times. Just below the knee, coming around and off the foot. 3 times. Once you've completed one round, you go back to the crown. Again, spread 3 times. I don't want you to be afraid to use this technique, since I've talked about using it with people who are transitioning, dying, because it also is profoundly relaxing and can be used for people who are under a lot of stress and really need deep relaxation. It's ideal if it can be done for someone who doesn't have to get up and go someplace after this technique, because it is so relaxing. I'm over the heart now. 3rd time over the heart. Back over the solar. Another beautiful transition that you can use this with is for mothers who've just birthed a baby. Once they put the baby on their chest, you can do a chakra spread over both the mother and the baby to help with the transition for both of them, as birth is truly another transition. Now I'm over the root. Then again over the knees. Ankles. And then off each foot again, as though you're pulling off an energy sock. Then one more time, it's 3 times 3. So this is the last spread, starting again with the crown. Then to the brow. Over the throat. Over the heart. Then to the solar. Next, the sacral. The root. Over the knees. The ankles. And then off each foot again, the last time, 3 times, energy pulling off the lower leg and off the foot. And then the way we end the chakra spread is again connecting palm to palm and one hand on the heart. So you're making a beautiful heart connection at the end. So that's the chakra spread. Another optional technique that is taught in level 1 is called the scutter technique. We are going to demonstrate this in our 4th video, so you will be able to see it at that time. I hope that this review of techniques has been very helpful to you. It's important to remember the principle of setting the intention for the highest good with all of the techniques that you use, and also setting the intention every day for the highest good for yourself and for all of those you interact with. I hope that this review of techniques and your practice will inspire you to take the next level of healing touch. And remember, even if you don't remember exactly where to put your hands with each technique, it's the energy that's important, the intention of the energy that you direct through your thoughts that makes it all work. If you're searching for classes, I recommend that you go to the website, which lists classes nationally and internationally. If you live in California, there's another website, healingtouchcalifornia.com, that also lists Healing Touch classes. To order videos, you can go to my website, thehealingjourneys.com. Thank you very much for your time and your attention.